Tired of reading pharmacology classifications? I'm Dr. Monica from Invodent presenting you Memorize with Mnemonics. Today let's learn drugs acting on ANS, classification of adrenergic drugs, classification of alpha and beta adrenergic blocking drugs. Here we go with the first classification in drugs acting on ANS, therapeutic classification of adrenergic drugs. Under therapeutic classification of adrenergic drugs, pressor agents is the first class you have to learn. So what are pressor agents? What are pressor agents? They are antihypotensive. So here is the mnemonic for you all. Please do exercise. Nothing can make you more fit. This is the mnemonic that you have to remember for pressor agents. Let us apply this mnemonic. Please do exercise. Nothing can make you more fit to the pressor agents. So phenylephrine, dopamine, ephedrine, noradrenaline, methoxamine, mephedrine. So all the starting letters are highlighted in accordance with the mnemonic given here. Hope you remember. The next group of drugs that we are going to learn are cardiac stimulants. So these are the drugs which aid for cardiac stimulation. Aid is the mnemonic here, AID. So these are adrenaline, isoprenaline, dobutamine. So AID are the group of drugs which causes the cardiac stimulation. So this is the mnemonic here, AID, aid. Coming to the bronchodilators, breathe some sort of fresh air at regular time intervals. So here, this is the mnemonic that you have to remember for bronchodilators. Bambuterol, salbutamol, salmeterol, formoterol, terbutaline, isoprenaline. So these are the starting words that I have highlighted in accordance with the mnemonic. Breathe some sort of fresh air at regular time intervals for bronchodilators. Next is nasal decongestants. This elephant badly needs a nasal decongestant. It's sneezing very badly. The mnemonic here for nasal decongestant is Mr. X nose is punched in one of the popular programs. So xylomethazolin, nefazolin, phenylephrine, oxymetazoline, pseudoephedrine, phenylpropanolamine. So the starting words are highlighted in accordance with the popular programs. Your loss of appetite. So Subhan controlled taking food. He is on diet. So SFD, Subhan controlled taking food. He is on diet. Sibutramine, fenfluramine, dexfenfluramine. These are the drugs which comes under anorectics. They cause loss of appetite. That's why Subhan is taking less food and he's on diet. Coming to the last group of drugs under therapeutic classification of adrenergic drugs, they are uterine relaxants and vasodilation. So these uterine relaxants were given to the pregnant women to delay their delivery and the birth of the newborn babies. So uterine relaxants causes the relaxation to the uterus and they cause vasodilation, which will postpone the birth date of the newborn. So Rita is going to give birth soon. So Rita is going to give birth soon. So it is delayed. It is like not enough. It is coming up. So Rita is going to give birth soon. Isoxaprine, terbutaline, salbutamol. So these are the drugs that are given to cause uterine relaxation and vasodilation. Next, coming to alpha adrenergic blocking drugs. In alpha adrenergic blocking drugs, you have two subclasses again, non-equilibrium type. In this non-equilibrium type, the mnemonic is no BP. What does the main action of this alpha adrenergic blocking drugs? To decrease your blood pressure and it calls you hypertensive. They are used in the treatment of hypertension. So here is the mnemonic for you. It is no BP. It is no means non-equilibrium type. BP means beta haloalkylamines, which comes under beta haloalkylamines. You have the drug called phenoxybenzamine. So phenoxybenzamine is coming under beta haloalkylamines, which is considered as non-equilibrium type. So no BP is the mnemonic that you have to remember for alpha adrenergic blocking drugs for non-equilibrium type. And it's under control. BP is under control when you use these drugs. Now coming to alpha adrenergic blocking drugs, equilibrium type non-selective. Here for the non-selective, it is Mr. Ergot. Here, Mr. Ergot eats and exercises. So ergot alkaloids, ergotamine, ergotoxin. So EEE, ergot alkaloids, ergotamine. Exercise is this E is ergotoxin. So the next level after ergot alkaloids will be hydrogenated ergot alkaloids. So dihydroergotamine, dihydroergotoxin. Just add dihydro for this above class. You will get the second group of drugs, that is dihydroergotamine and dihydroergotoxin. Next, for imidazolines and miscellaneous drugs, we have one phrase that we can use as mnemonic. It may not be only exercise. Some form of physical training may also be considered. In that, imidazolines, phentolamines and tolazoline. In miscellaneous, chlorpromazine. So I, imidazolines, P, phentolamine, T, tolazoline, M, miscellaneous, and C is chlorpromazine. So imidazolines, you have two drugs. Under miscellaneous, you have chlorpromazine. Coming to beta adrenergic blocking drugs, non-selective, beta 1 and beta 2. Here is the mnemonic for non-selective beta 1 and beta 2. Give tips to Peter for his class test. Without intrinsic activity, intrinsic sympathomimetic activity, with intrinsic sympathomimetic activity, with additional alpha blocking property. So these are the three groups of drugs under non-selective beta 1 and beta 2. So let us first see the first one, without intrinsic sympathomimetic activity. Here is the tips: timolol, propranolol, sotalol. So these are the tips. Okay, give tips. With intrinsic sympathomimetic activity, Peter, P, pinodolol. Okay, and class CL here with additional alpha blocking property, carvedilol and labetalol. Coming to the last group of drugs, beta adrenergic blocking drugs, cardioselective, especially beta 1 blockers. Cardioselective. BBC News is always affirmative and effective. You may follow it. So here is the mnemonic for you for cardioselective beta 1 blocking drugs. So these are the group of drugs. Here we go like this: bisprolol, betoxolol, celiprolol, nebivolol, etinolol, esbutolol, esmolol, metoprolol. So all lols. Okay, all the first words. BBC News is always affirmative and effective. You may follow it. Hope you have liked this video. Stay tuned for more classification and simpler and easier learning. Keep preparing for your examinations. All the very best. Thank you so much for your patient hearing.